Your child does not yet have enough strength in the body to support the weight of their own head, neck, and trunk. Until the child's legs are able to bear the body's weight properly, forcing them to stand can be harmful. You may have noticed that many children develop hip dislocation. Think about it: if the child was not born with a hip dislocation, then why did it happen later? Parents visit doctors and therapists every day for treatment, yet hip dislocation still happens. Have you ever wondered why? One major reason is that people often do the wrong things in a hurry to make the child stand or walk quickly. They tie straps around the child and make them stand on a tilt board before the child's body is ready. This puts excessive pressure on weak hip joints and can cause serious damage. Once the hip gets dislocated, parents run to the doctor, and then the orthopedic surgeon says surgery is needed because the hip joint has come out of place. But have you ever thought about what happens after that? The doctor puts the hip back in place, and then the child may have to remain in plaster for 3 months. After the plaster is removed, ask the doctor one important question: if the child is again forced to stand before the body is truly ready, can the hip dislocate a second time? The answer is yes, it can happen again. And if surgery was done the first time, do you think the child did not suffer pain? Why should we put a child through such pain when the same dislocation may happen again later? Instead, work with the child in a way that makes the hip stronger and more stable so that dislocation does not happen in the first place. Even if dislocation has already occurred, proper work and guidance can still help improve the hip joint without causing unnecessary pain. By learning the correct methods from our team, parents can help their child gradually become strong enough to stand and walk independently, just as we ourselves learned naturally when we were children. Surgery often causes a lot of pain and requires the child to stay in bed during the very age when they should be playing, moving, and enjoying childhood. So please think carefully before making such decisions.